I am Pamela D Wilson, caregiving expert, advocate, and speaker. I'm your host, your instructor for this webinar. We're going to be talking about becoming an advocate. And in this part in particular, advocating with the healthcare system, learning how to use medical portals, and I'm going to talk about virtual appointments. But as always, we start with housekeeping. I use the term elderly parent or elderly parents. Substitute this term with the person for whom you are caring. All of the materials for this module, the outline, the slide handouts are there for you to print out. As you will notice, I put dots on the slides. Those ellipses are very purposeful. They help you fill in the blanks about information that we talk about. Let's talk about the objectives of becoming an advocate. You will be able to use systems to advocate for the care of elderly parents. And this includes identifying steps to take to become more confident to advocate for the care of elderly parents with medical providers that you encounter. You'll be able to relate the care needs of elderly parents to situations that require you to step up and advocate. You'll recognize how physical, social, and cognitive activities support healthy aging and develop systems and tips to help your parents be more active. In talking about medical and health care, you'll be able to use that care plan that you developed, I hope you did, to advocate for the health care of an elderly parent because you have information. You'll also begin to formulate a plan for coordinating care and talking to a variety of different organizations who care for your parents' health and well-being. Learning to advocate for elderly parents benefits from the systems, the routines, the processes that we are talking about to identify needs and to help providers help you. In other modules, we talked about processes to navigate doctor appointments, how to manage medications for elderly parents, understanding chronic diseases and geriatric syndromes. And earlier in this part, we talked about developing a care plan for elderly parents. In this part, we're taking all of this one step further. We're adding another building block of skills to help you manage the care of elderly parents by talking about advocacy and working with medical systems. Let's look at the barriers to advocacy. Why is this difficult? So advocacy includes caregiver skills. It includes the willingness of elderly parents to participate in a lot of other unexpected situations. For caregivers, the barriers or gaps that exist include a lack of time, working and caring for elderly parents, trying to manage your own life, language barriers if English is a second language. A barrier can be feeling intimidated by talking to healthcare providers like doctors and nurses. It can be transportation difficulties. Your parents have difficulty getting to an appointment. You have difficulty getting a car to take your parents somewhere. And also financial concerns are a barrier. Each caregiving situation is different. It has different challenges and barriers. Elderly parents also have similar barriers and gaps. Your elderly parents may be fighting tooth and nail. They may be resistant to changing lifelong health habits, which doesn't help you care for them. Elderly parents may refuse to participate in care. They may believe that you, the caregiver, is overprotective and that you worry too much. Elderly parents may have similar feelings of being intimidated by working with healthcare providers. They may have transportation issues. They may worry about money all the time. So we'll talk about the basics of advocacy, and I want to put this in terms of technology to support medical care for elderly parents, especially if there are transportation issues. These can be great steps to follow. Are you aware if your parents' doctor's office or your doctor's office has a medical portal? One option to access health information and to communicate with medical providers is their online health portal. Many of the larger medical offices have these electronic health portals. Some smaller medical offices, if they are not on an electronic system, they still may be using paper records, but everybody eventually has to get here. If your elderly parent's doctor has a health portal or a patient portal, those are medical speak terms for a website for the doctor's practice, where you can sign up and you can go online to review medical history, make appointments, communicate with your doctor and staff, request refills. So what you want to do is gain agreement from your elderly parent to sign up. The office will give you a user ID and a password to log into the site. You want to log in, make sure you change your password if that's allowed. Medical portals can be a really great time saver. On the other hand, they can be frustrating, and I'll talk about why in a moment. But wherever you are in using this portal, from a location standpoint, you or your elderly parent will need a good internet connection. You can connect using a computer. Some medical offices have an app that can be installed on a cell phone. Time-saving aspects are the ones that we discussed about having access to medical history, past appointments, a list of medications. You can make requests through the portal to refill prescriptions, to schedule medical appointments. You can opt in to receive text message reminders about appointments and other types of correspondence. You can also ask questions. So let's talk about frustrations. And you see the guy in the slide just scratching his head. Communicating through medical portals can be an area of frustration. You want to realize that the person who responds to your requests isn't always the doctor. Could be somebody who just checks the portal every day and answers back. So what does this mean? It means that communicating through a medical portal, you may ask a question and you might get an answer that makes no sense, or an answer that doesn't follow along with the last discussion you had with the doctor. This is where the frustration comes up, because you can feel like you're wasting your time if you're corresponding with somebody who isn't the doctor or who can't answer your question. My recommendation is, if you receive an odd response or something that doesn't make sense, ask back and say, is this the doctor answering my question, or is it somebody else? Then take the time to explain the issue factually, be clear about the information, be clear about your conversation with the doctor. And if all else fails, call the doctor, see if you can talk to somebody, set an appointment if you have to. And the reason that this miscommunication happens is because many times the doctors don't have time to check the portal. I can share a couple of examples where I sent information through a portal about a medication, and the person responded, well, you'll have to set another appointment. And I responded back and I said, that is not what the doctor and I discussed. Are you the doctor answering my question? The person admitted that it wasn't the doctor answering my question. So I said, I'm not going to set another appointment. This is what the doctor and I discussed. Go ask the doctor and come back and answer my question. Another provider, another situation about a bad shoulder. There was a question about over-the-counter medications provided for pain. And so that question was posed through the portal. And the person came back and said, well, if it's not working, just come back and schedule an injection and we'll get that done. My response was, did you look at the medical record of this patient? Do you see that they cannot have injections because they are allergic? Why are you recommending normal suggestions that don't apply to this patient? Did you even look at the medical record before you responded? These are the risks that you must know about when you're working through these portals. This is why your care plan, your medical records, your notes are valuable, because people are going to respond. They're going to respond and they're going to make recommendations that don't make sense. They could make a recommendation that harms your elderly parent and not take responsibility for it. It's up to you to be very accurate, very thorough when communicating with doctors through these medical portals to get the care that you need and want for your elderly parents and to avoid unnecessary mistakes. Let's talk about virtual medical care appointments, which can and cannot be helpful. There's two sides to every story. Some medical providers are scheduling virtual medical appointments through their health portal or an app that you download to your cell phone. They are an effective manner for routine health concerns when your elderly parent has already established care with a doctor. They don't work if you're trying to get a new patient appointment. You do need a good internet connection for the appointment to work. Medical concerns that lend themselves to virtual medical appointments are routine, like a cough, a cold, a sore throat, a skin condition, prescription refills, any type of routine questions. You want to do the same level of preparation as you would if you were going to the doctor's office to identify concerns and be clear about the action. Many times you get on the portal and you can express concerns there. So before attending a virtual medical care appointment, complete all the necessary steps we talked about for attending a doctor appointment in the other module. You can help your elderly parent check in online. You make the appointment copay using a credit card. You enter information about the reason for the appointment, complete a checklist of symptoms, review all of the medical information, the medical history, prescriptions. You want to make sure the information is accurate. And you can complete that step early, like in the day, and then log in a few minutes before the appointment. It's also important to have a backup plan with the medical office. If for some reason that connection through the computer or the app does not work, who do you call in the office? Does someone in the office call you? Make sure that you've got that system to complete the appointment because you'll have paid for it. And as we know, technical glitches do happen. This is no exception. Accessing medical portals and attending virtual medical appointments can be challenging for elderly parents without you if they lack technological skills or they're easily flustered when using the computer. If this is the case, do a trial run if you won't physically be able to be with your parent for that appointment by going to their home so that you make sure everything runs smoothly. You can also make sure that your elderly parent completes any follow-ups from that appointment. That could be picking up prescriptions, going for blood work, scheduling an in-office follow-up appointment, or posting information like blood pressure readings or blood sugar readings into the portal. You want to close all of the loops from any virtual Medicare appointment the same way that you would if you were attending in person at the doctor's office. Let's talk about why it's important for you to be that advocate. Because the healthcare system is made up of so many providers, honestly, you can feel like you're juggling appointments and tasks and tests and all of that. You might be interacting with the doctor's office, then the pharmacy, an insurance company, a treatment center, a lab center. The more people that are involved, the more easily communication goes off track. Insurance coverage may be denied because somebody doesn't have the right information. Your insurance company may not accept the information that your doctor told you. That's when you'll have to call and follow up. As an advocate who is coordinating care for an elderly parent, sometimes you can feel like you're getting the runaround, and sometimes you are. When it seems that you are receiving a different story from everyone you talk to, document everything in that care plan. As we talked about the date, the time, who you spoke to, their phone number, what they agreed to do to follow up, when they're going to call you back. Because when you have that level of detail and that level of clarity, it's easier for you to establish expectations and level the playing field so that you don't feel like you are bothering a medical office. They should know that if you said you would follow up, you will. And they should know if they said they would follow up, they should. So as you can see, technology can make communication with healthcare providers easier, can also be a challenge. There can be snags. But this is a point where you want to become that advocate and help your elderly parents, because a lot of them can't do this if they don't have the right technology or technology skills, or they have poor internet access. They can't get on these portals. They can't attend virtual medical appointments without your help. And these are all the situations where your skills of advocacy and care coordination and speaking up for the care that your parents need has to happen. Your goal from this part is to, if you have not, obtain login information for the health portal of your elderly parent, access that portal, You do have to be the medical power of attorney for an elderly parent, or you will need that HIPAA release that we talked about to allow you to access the portal. Then take the next step. You can also ask the office if they provide virtual appointments so that you know what steps you can choose if an in-person appointment is not possible, if it can save you some time. The more you know about how all of these medical systems work, the more confident you will be in communicating with medical staff, making and attending appointments with your elderly parent, and knowing when information that you are being given isn't accurate, being able to use that care plan and rely on that information to get the care that you want for your elderly parents. Technology for healthcare is only going to increase. It's going to get better. Today, there are snags. You may set a virtual appointment and you may not be able to get through. Make sure that you give the medical office feedback about that, but do continue to advocate for your elderly parents with all of these providers. They can't do it by themselves, and many times they become so flustered. Having that care plan document is your brain, it's your memory, it's the encyclopedia of care for your elderly parent. I'm still encouraging you to put it together if you haven't. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. Thank you so much for being with me for this webinar series. I appreciate your time and your dedication to the care for elderly parents and loved ones. I'll see you again in another webinar.